how a hiatal hernia causes anxiety symptoms and panic attack. If you're somebody who's suffering with hiatal hernia or acid reflux, you are at 4.5 times risk of suffering from anxiety. Other studies showed younger patients aged 18 to 40 had double the risk of suffering from anxiety. So this is a very real connection. And what does it have to do with? There's a muscle, a nerve, and gut health, and so let's dive right in and see what it's all about. So the muscle we're talking about is your diaphragm, and it is an organ also, but it's a very strong muscle and it brings air in and out. So as long as we're alive, that diaphragm is working. But what happens, well, first of all, structurally, how does your esophagus, the tube that connects your mouth down to your stomach, how does it pass through the diaphragm? There's an opening in the diaphragm, and that's called a hiatus, and that's why when you have a hiatal hernia, a hernia is something coming up through an opening that should not be there. In this case, we're talking about the stomach. So the esophagus should pass through, the stomach should not. But there is that normal opening of the esophagus as it passes through the diaphragm. Interestingly, the nerve we're going to be talking about, the vagus nerve, which is a cranial nerve, it passes right alongside, along with the esophagus, through that very same opening. So one thing that happens when you have hiatal hernia is that the irritation to the stomach and the diaphragm, because you have to understand the diaphragm is supposed to float up and down 2 to 5 inches depending on how deeply you're breathing, and be very comfortable with that motion. It's not supposed to have the stomach jammed up beneath it or into it in the case of a more severe hiatal hernia. And what that does is it alters the tension or tone of the diaphragm. And the irritation of acid reflux, having irritation in the stomach and also the irritation of the acid into the esophagus, it all irritates the vagus nerve. So they're very, very tightly connected. Now, when the vagus nerve is irritated, you can experience symptoms like heart palpitations, shortness of breath, and also dizziness, and also chest tightness. So if you suddenly feel very tight in your chest and you have shortness of breath and your heart is palpitating and you're dizzy, you're going to feel anxious, right? So they kind of go together. At this juncture, I do want to say that when I'm talking about heart palpitations and I'm talking about shortness of breath, this is with the understanding that you do not have heart disease, that you've had these heart palpitations checked out, you've had your shortness of breath checked out. So I'm not saying that, in addition to the dizziness and of course chest tightness can be cardiac related and lung related as well. So I'm talking about these symptoms from the viewpoint that you don't have heart disease and you don't have lung disease. You've had that checked out, but you still have the symptoms. So the symptoms are very real. They are happening, but it does not equate to heart disease or lung disease. So let me make that perfectly clear. Heart disease is our #1 killer. If you have any symptoms of your heart acting oddly in any way, shape, or form, first place, urgent care or your doctor, and make sure you're not having a heart attack and you don't have heart disease. So now that we've had that little interruption or commercial break, we're back to the fact that these symptoms are very real. And that's something that's very frustrating with somebody that has hiatal hernia symptom is, they tell their doctor, my heart is just palpitating out of my chest, or I really can't get a breath, I'm breathless, and I have all this anxiety, and they can't find anything wrong with you. And it's very frustrating because there is something wrong and you're not making it up, and these symptoms are very real. And it has to do with this interplay that we're discussing right here. All right, so we talked about the vagus nerve and how when it gets irritated, it can create all these symptoms. So you get into this kind of stress, anxiety loop that all starts with reflux and or hiatal hernia, because with hiatal hernia you're going to have a degree of reflux. And so you get the reflux, the stomach pushes up again into your diaphragm, so your diaphragm can't move as freely, and then You feel short of breath, so you get anxious. You start to kind of hyperventilate, right? Because you can't get a breath, and so you're not getting enough carbon dioxide because you're right. You're breathing in because you feel like you can't breathe. So of course you're going to breathe in more than you're not relaxedly breathing out. But what's key about this is that your vagus nerve runs mostly your parasympathetic nervous system. Now the flip side of parasympathetic is sympathetic. So that's your fight or flight. The adrenaline's flowing and you're moving really fast, and and it's perfectly fine to be in fight or flight. A lot of us are during our normal day-to-day, but we need that balance of sympathetic and parasympathetic, because parasympathetic is rest, digest, relax, and we need that in our day as well. And the vagus mostly runs this rest, digest, relax, parasympathetic nervous system. And if you're in this hyperventilation phase because you're feeling anxious and you're short of breath and your heart is palpitating, you're staying in fight or flight, and that's a very anxiety provoking state when you're having these symptoms. Now, I'm in fight or flight right now because I'm talking to you and we're recording this video, but I'm not anxious about it. I'm having fun with it because I love doing this. So there's two sides, but what I want to get across is that this breathing, this hyperventilation is creating this vicious cycle, vicious loop of because you have the symptoms, you feel anxious, and because you're anxious, you're hyperventilating, and because you're hyperventilating, you're in fight or flight, and on it goes, and you're irritating your vagus nerve, and it really is this vicious cycle. So hopefully that makes sense. So now, what do we do about it? And there's things that I'm going to teach you that you can very much do something about on your own day to day, and then other things you might need some assistance with. So starting with, actually I'm going to end with showing you how to release your own diaphragm. But breath work is very, very key, because what breath work does is it relaxes your vagus nerve so you can get more into that parasympathetic mode. Now there's a few types of breathing techniques that do this. One is called box breathing. You can look that up online. Very simple. They're all very simple, and I really urge you to practice them because they make a huge impact. And you go, breathing, I'm breathing anyway, but you're not breathing like this. One is called a physiological sigh, and that's taking a deep breath in and then letting it out very, 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 very slowly. So you're exhaling very, very slowly. So you're having more time in carbon dioxide mode versus oxygen mode. And again, that's very healing and calming to your vagus nerve, which puts you into the rest, digest, relax. So if you're in an anxious mode, it really helps. Now, it's not easy. It's easy to breathe, but when you're talking about intentionally just taking a deep breath in and then very slowly letting it out, when you're a bit tense, it's going to be hard. You're just going to want more air, It's okay. Just keep trying, and you'll just incrementally get out of that fight or flight and more into parasympathetic mode. So it's an exercise. Are you great at a certain exercise the first time you do it? No, you got to do it and do it and do it and do it. So give yourself some grace, take time, but practice this. It's very, very helpful. Another thing is humming. And it's not like humming, it's humming. So if you do that really low hum, you'll feel the vibration in your chest, and it's that type of humming that helps the vagus nerve. There's a whole complex neurological explanation, which I won't go into, but trust me, it's that kind of humming. So those are the things I want to go over with that. And then we have to get into treating the root causes of why you have hiatal hernia and why you have acid reflux. So that gets into perhaps you needing a bit more help, because the whole aspect that's happening here is that your stomach pressure is being placed upon your stomach that's causing it to constrict. And when it constricts, it has no choice but to bring the acid that is contained in your stomach up into your esophagus. So, it's like you squeeze a balloon, it's got water in it, the water's going to go out the top, right? So it's kind of just basic physics there. But what is the source of the pressure? See, that's what's key. And it can be anything from you have belly weight, and so your belly fat is putting pressure on all your organs and working toward that. And I go over in a lot of different videos. There's one entitled Belly Fat and How to Lose It that you can look at. But also there's inflammation. So there's generalized inflammation in the gut that's creating a lot of pressure. So why? Why do you have inflammation? Do you have a food sensitivity? Do you have an infection like small intestinal bacterial overgrowth? Or do you have an infection in your stomach? Is the infection in your colon? The imbalance of good bacteria to bad bacteria is called dysbiosis, and it talks about just that balance or imbalance, properly said, of your colon. And that has to do with your microbiome that has 60 to 100 trillion organisms. Now, that can sound overwhelming. It's not. There's testing we can do to see how is your microbiome health and balance doing, and then help rebalance it through natural means. These are all natural means. I'm not talking about drugs. Further, we want to look at toxicity levels, meaning you can be toxic from a lifestyle you have, something you do for a living. You can be toxic because you have mold. You've had mold exposure. Mold is horrific. It's not that hard to treat at all. It's just, I say it like that because we just see so much of it these days. And the multitude of symptoms associated with mold toxicity is huge. It's a very, very, very long list. But it's all about teasing out what are the root causes that are creating this inflammation and pressure in your gut. Because it's that pressure below. Oh, constipation is another one. But we address it with the same types of things, food sensitivities, balancing the microbiome. Are there toxic levels of anything? It's just teasing it out based on you and your background. But I want to finish up with the diaphragm release. I'm going to stand up for this. So your stomach is a little bit to the left. So there's my ribs. Okay, I'm outlining them there. And you want to go just below the ribs on the left. And you're just going to do a push and a down. It's like a scooping action that you do. And you can follow your rib cage all the way along the left side, and I would do the right side as well. Some people find it easier to do this on their back, okay, because it's just a little bit easier, and it's just that it's a very gentle massaging scooping action that can help relax the diaphragm. So try that. I know we went over a lot today. Hopefully it made sense, especially if you're suffering from anxiety. There's so much that can be done for this. And notice I mentioned a muscle, a nerve, and a gut. I didn't mention a brain. This is not in your head. These symptoms are very real, but the way to tackle them is in this fashion. So I hope you enjoyed this. Please send me a comment, subscribe to the channel, and I look forward to talking to you soon.